started. So good morning, everyone. Like I said, thanks for taking time out of your morning to join us on this panel. My name is Charley. I've introduced myself briefly to you all, but I work with the Chamber with the Success School program, which basically offers students in both MCCSC and also RBB schools with career readiness, entrepreneurship, soft skills, lessons, and things like that. And so one of the things we were doing pre-COVID was in-person career panels where you'd come to the school and talk to the students directly, but obviously that's not an option right now. So we moved everything online and are trying to get as many virtual panels done as we can to pass on to students who are looking at post-grad options this year or will be looking into those things. So it's going to be pretty quick, just like maybe 35 minutes at most. And we're just going to go over like 3 or 4 questions. And the first one will be the most basic of providing your name, the industry you work in, who your employer is, and what your job title is. And Sarah, if you want to start, since you're the first one to the left of me, that'd be great.
Sure. Good morning. My name is Sarah Hatch, and I'm the Director of Student Recruitment for our School of Public Health that's located on the Indiana University Bloomington campus. So I work in admissions and recruitment, specifically for the School of Public Health programs at IUB.
And then Keith, do you want to go next?
How about now? Can you hear me? Hello?
You're good.
Oh, okay. All right. Hi, my name is Keith Rademachier. I work for Ivy Tech of Bloomington, where I'm the clinical director of the Paramedic Science program. I was a paramedic for 28 years. I'm not currently working as a paramedic, but I'm an instructor at Ivy Tech.
And then is it Chelle or Chelle?
Chelle.
Chelle. You can go ahead and finish this up. Sorry about that.
No, you're fine. My name is Chelle Filippelli, and I work for the School of Nursing at the Bloomington campus for the IU School of Nursing. Bloomington campus is a part of a core school. A lot of people don't realize that with IUPUI and IU Fort Wayne, so that's why I say the Bloomington campus. I'm the admissions coordinator, and I work on the student services and advising team. So I'm usually the one who speaks to prospective students, especially those in high school. The Office of Admissions is doing a big event tonight, really for students interested in IU, and then they get to sign up for breakout sessions for those who are specifically interested in nursing. It's really important that students come to these because nursing is very different. There's no direct admission. It leads to professional licensure. So there's a lot of little details with nursing that are important for high school students to know.
So going off of that, you all kind of are in the school side of your profession, less in the field doing the work. But what is the path you suggest for students to take who may be interested in your specific fields, not necessarily doing what you're doing, but becoming a nurse, becoming a EMT or EMS, that kind of thing? What does that look like for you? And any of you can start answering.
I'll go ahead and start. So I feel like students who are typically drawn to the field of public health are those who really value quality of life and those who want to improve the lives of others and make a positive impact on the world. So if you really are into helping, we have several majors that can help you do that in either a clinical sense or research sense or hands-on out in the field doing the work.
Okay, I'll go next. Typically, when I speak to high school students, the ones who think they're interested in nursing, it's usually because a family member is in nursing, or they thought it looked cool on TV, or they are very compassionate people and want to help. And then there's also some people who are just very interested in kind of getting in the front lines and doing that sort of work. One thing I think is very important for prospective students to distinguish is that sometimes public health ends up being right for them. I was a dietetics major back when it was hyper. And not everybody's cut out for nursing, and it's a joyous and rewarding field. It pays well. Students will most likely have a very good job when they graduate, but let's face it, people pass away, they're grumpy, they don't feel well. I can't do blood and needles. Otherwise, I would have been a nurse. So sometimes before we even get to that place of looking at requirements and so forth, I encourage students to shadow and make sure that nursing is really for them. I think that's really important to talk about.
I think the kind of students that are normally drawn to the EMT or paramedic program are just like the other two. They're careers that can really make a difference. You are out on the front lines. A lot of times the very first people to encounter somebody that may be having the worst day of their lives. And you're there to help them through that. To get into this career, it just takes jumping in and doing it. So to get a start, you'll need to come to an EMT class, get your EMT certification, and then if you want to go on with that and you decide that this is a career for you, then jump into the paramedic course. It's a little bit longer with a little more training. However, the level of skills that you will learn and procedures that you'll be able to do actually out in the field are far greater.
So do you find it typical for, like, what is the typical, is it college and then more college and then you get into your career, or what is the typical path for a student? Is it, I mean, you've kind of hinted at it, Keith, of like taking a licensure exam type deal to get where you need to be, but like, what is the typical path post-graduation that you see people who want to do your field go through?
So post-graduation, the course here allows you to sit for the certification exam, after which, upon passing that, you'll be certified with the National Registry of EMTs as an EMT. Most states will accept the National Registry as also a state certification, and they will give you the state certification. Once you do that, then my suggestion would be, in the normal pathway, is to actually go and do some work in the field as an EMT, which is an entry-level position. Once you work for, I'd say probably around 3 to 5 years as an EMT, then most people after that time have pretty well got an idea if they're going to stick with this or are they going to move on to something different. And at that point, usually most people make the decision to go back to school and get that paramedic licensure, which takes about an additional 2 years.
So I think I would like to add on a little bit to what I said earlier. I'm not sure I quite answered your question, and then I'll also answer this one. You know, it's really important. I always encourage students to learn more about the field of nursing and also shadow. Well, shadowing's not possible right now with COVID. They're not allowing volunteers and so forth. So I absolutely 100% recommend that students who are interested contact me, but also sign up for one of my regular virtual sessions that I do through the Office of Admissions. It's extremely important. A lot of students, when they get to that point of thinking they're in nursing and then they really find out what it's about, are sometimes quite surprised. So to piggyback on that, I would say the most traditional route is to go to an ASN program, an associate's degree program, such as Ivy Tech. I have nothing but great things to say about their program, or for a BSN, for a bachelor's degree of science and nursing, which is what we offer at IU Bloomington. Those are the typical routes, but you know, I always tell students, because our school is very competitive. We only accept 80 students every year, and we get 200 plus applications, and the average GPA this year was 3.9. So when I see students tear up or they say, oh, I can't do that, well, first of all, yes, you can. You can, and there's a lot of support to help you with those prerequisites. But there's some other options. Some of our students go and get their degree in a public health field or any other field, you know, such as community health, with the intention of coming back and doing an accelerated program. And that's a second bachelor degree program for nursing that is kind of an intense 16-month program where students earn a second bachelor's degree. They're not taking all the gen ed because they've already done that. They're going right into nursing. So that they might have their undergrad, you know, their undergraduate degree in community health, for example, and then they also go back to school for nursing. So that's one way. And another way is for students who have an associate's degree at a community college, go in the field and work in nursing. They can come to an RN to BSN program, which is another program that we offer. And that's really, really a great pathway for students who want to get to work a little earlier. So they'll get their associate's degree in nursing, and then their employer helps them pay for them to go back to school part-time online with tuition reimbursement to earn their bachelor's degree, which will open the doors for more promotion and management.
And I would say too, with our school public health program, so there's so many majors that students can do. We actually offer 16 different areas of study within our school public health, but many of our students want to go on to programs that do require advanced degrees, so a degree beyond a bachelor's degree. So some of my students want to pursue athletic training or physical therapy, occupational therapy, medical school, law school. All of these are options that you can achieve once you've completed a bachelor's program first. And some of our programs too actually have like hybrids to them where they have the prerequisites embedded into the bachelor's that will help get them prepared to apply to those graduate programs. So a lot of different options, but that's usually the path. They'll get their bachelor's first, and then they'll go on to a graduate program, and then their ultimate career goal.
Awesome. Yeah, I am an IU student. I went there for undergrad and I'm there now for my master's, and I have plenty of friends who have done all of these things. So it's really awesome to hear from like your guys' perspective how those programs work. And I've also heard my friends all have really lovely things to say about your program. So I highly suggest to students that if this is something they are interested in, they have this campus right here, both Ivy Tech and IU Bloomington, that are completely accessible to them to get into these fields. And I think that's really great that they don't need to go far. They don't need to, you know, go to Indianapolis or elsewhere to get that experience. They can get it right here if that's what is best for them. And so great. I'm so glad you guys got to speak on that. I think something that I want to talk about is, what would you say like the biggest challenges are in your fields, in nursing, in finding a career in that, in finding a career in public health or in EMS? It doesn't necessarily need to be the academic challenges, but what are the challenges inside of that career field that you see coming to head at the moment?
I think the biggest challenge within EMS is right now there is a national shortage of EMTs and paramedics. So within the system itself, staffing tends to be a bit of an issue, making sure that we have plenty of equipment available and running that is staffed. That being the case, though, it also pretty well ensures that people coming out of the EMT or paramedic program pretty well guarantees job placement. It's out there.
That's great. That's very similar to nursing. Most of our students who walk across the stage in May, when they graduate, have jobs lined up. Of course, that's pending the results of their NCLEX, their state board exam for licensure, but most students do have jobs lined up. So we have a very, very high placement rate. I think the challenges that I'm seeing are new graduates want their dream job. They want the perfect shift, and they want to go work in the NICU, which is for newborn infants, or a kind of a specialized floor in the hospital, and that's not really common. Most healthcare providers want to hire new grads for kind of a general area such as emergency room or medical and surgical, where there's a little bit of everything. And then they'll help you, typically get to your goal within a few years, and they provide additional specialized training. But I think what I see most is just students wanting that dream job, but sometimes it's med surge, night shift. That's just a reality.
And I think it's important for students to realize that, whether it be nursing or EMT or our public health programs, people are unfortunately always going to be sick, always need care.
Right.
Public health impacts every person on the planet nearly every day in some shape or form. And this comes down to like physical activity, nutrition, the environment, recreation, all of that impacts our health and how our environment impacts our health. So our school really has a preventative approach, and we're working on ways to prevent these issues before the problems arise. So how can we prevent the next global pandemic, right? What can we be doing in our communities and with individuals? But I was talking to some of our faculty about, what they think the biggest challenges are in the field of public health. And many of them commented that physical inactivity and the obesity epidemic and environmental change, right? We're seeing all of those fires taking place right now on the West Coast. And we really need to think more broadly about how our environment, whether it be our home environment or our climate, is impacting and influencing our health. So not just from air pollution and its effects on our health, but like our exercise patterns and our access to healthy foods. And so our school public health is really studying these things and figuring out strategies that we can implement in our daily lives to improve these challenges.
Yeah, those are great points on what are the different challenges. And I hope students can see that every single path, no matter what program you go into, is going to have some sort of challenge. And you have to kind of ask yourself, is that something you want to be involved in? Is that a challenge you're okay with fighting and that kind of thing? And I think that it's important for them to know that ahead of time before they, start to figure out what they want to do with their their lives. Is that something they even find passion about? Yeah, Chelle.
Sorry, I was on mute.
Oh, you're good.
You're making me think of other things when you talk.
Yeah.
It's like, oh, I didn't mention that. One thing that I'm talking to students right now about who are attending prospective sessions, besides think about being a nurse and what that looks like, is we're in the middle of a pandemic. Our nursing students right now, we've had a couple faint because they're wearing full PPE and it's hot and it's claustrophobic and they're not used to it. Clinical start at like 5 a.m. They're driving to clinical. It might be 5 degrees outside and dark, and it's a long 12-hour day. So more than just nursing and having compassion, you have to think about yourself in that situation. Is that really a good match for you? How would you feel if you got attached to a patient, and they passed away? Being on your feet all day and your back hurts, even when you're young, your back hurts. So I'm really encouraging students to think about these things, because I'm not recruiting in nursing. We don't feel right about that because it's competitive, but it's important to supply the information, the joys, but also, the challenges.
Sarah, did you have something you wanted to add?
Yeah, I would just add that, yeah, sometimes figuring out what you don't want to do is just as important as figuring out what you do want to do. So listen to those, feelings that you have in your chest when you're like, oh, I don't know about that. I don't know if that's going to be right for me. And that's okay.
Right.
Yeah, I mean, I give a lot of just kudos to people who go into this field because I knew since I was a kid that it was not right for me. I was like, I'm not good with needles and blood, and I love helping people, but not in this capacity. And I agree. Sometimes it's just as good to kind of be like, this is my list of things I don't want to do or I'm not
Right.
okay with doing or I have a fear of. So it's not good for me to go into it. And I think you guys kind of hit on this, talking about the pandemic and things going on right now. How do you feel this has shaped the field? And then where do you see the field going after this? Because I mean, for people my age, this is unprecedented. I think for most people, it's unprecedented. So what do you see it kind of taking shape right now? And then where do you see the field going post-COVID? Hopefully, once we have a successful, widely spread vaccine and that kind of thing. I'm just curious on that kind of perspective.
And so I think the way it's shaping it right now, I think it was touched on about wearing the full PPE, all the protective equipment. It's extremely hot. It's extremely restricting. It's hard to work in. I think also even down to certain procedures that we try not to do unless absolutely necessary because of the huge risk of spreading, COVID through that. So I think there are a lot of changes that are going on right now with that. And, we're still kind of, in EMS anyway, we're still kind of learning a lot about this. And we're still getting used to that new normal that we have to work with to keep ourselves safe. I mean, safety is one of the things that, we've got to push because I know it's very easy to get out there and doing your job and, to sometimes get maybe a little bit unsafe. But you've got to stop and realize that, your safety is first. It's got to be. If I'm not safe, then I'm not able to come and take care of other people. As far as the future goes, I think it's leaning more toward a home healthcare type of route. It was mentioned earlier about preventative medicine, and that's a big thing in EMS as well. It's called community paramedicine, in which case we don't just respond to 911 calls in emergency situations, but we also respond to homes to do things like lab draws and welfare checks and assist with medications and other, medical procedures that would normally be done in hospital, but are now starting to fall back to EMS for us to do them in the field to keep people as much as we can out of hospitals. They're overloaded, and a lot of patients with COVID are showing up there, and unless you have to go in for an emergency procedure, we try to keep people away from that. So I think that's a big thing for the future of EMS is more clinical care as opposed to emergency care.
That's really good to hear. I don't really know yet. We're still in this, so my colleagues and I always talk about, I wonder what this will look like, if it will change admissions or prospective students' interests and so forth. We don't really know yet, but I will tell you so far, I have not seen it slow down a bit. And when I talk about COVID and full PPE and these things, I'm not really seeing a lot of people say, oh gosh, that sounds really scary. I think with nursing, at least, sometimes you don't know until you get in it. That's why I'm really looking forward to when students can go shadow again, because I think it's so important to really get in there and get a feel for it to see if it's a good match. I think there will be plenty of jobs. There will continue to be plenty of jobs for students. Not all nurses will be taking care of COVID patients, but of course they need to be aware of all the precautions. As Keith said, preventing the spread and so forth. I am seeing an uptick in interest for graduate school, the path for nurses to be, for example, a nurse practitioner. And I think the field is hugely open for that. When I was a kid, we didn't see PAs or nurse practitioners, we saw doctors. And now it's almost hard to see a physician or get an appointment. A lot of people typically will see a nurse practitioner or a PA for their care. And whether that's in an emergency room or an office or a hospital. So a lot of students will ask me about the PA path, which is very different, physician assistant, and nurse practitioner. So BSN, our degree is the path if that's what students are thinking. There's a huge surge in telemedicine visits, as you all probably know. So I think the job field is very, what's the word I'm looking for here? I think there's a lot of opportunity in nursing, even if you're not working by the bedside. Corporate nursing, you may never put on scrubs in certain nursing jobs. So.
I would just add on to everything that's already been said about, if anything, I feel like the global pandemic has really pushed public health and how it impacts us all every day to the forefront. And so, I used to get asked a lot by students, like, what is public health? I don't really know what that is. And I hope now, people are seeing it's the safety of communities, it's the safety of your family, it's your personal health, it's huge and it impacts us all. And unfortunately, I don't see it going away anytime soon. So the good things for the students who might be listening to this, there are going to be plenty of job opportunities. And I really want students to know that you can help people without having to be by that bedside or in that clinical environment. So, as you're hearing some of the things that we're talking about, if that doesn't sound like what you want to do, but you still want to help people, there's so many different ways that you can do that. But I think, having a background in public health or in some type of health related area is going to be so influential and helpful for any student moving forward, because it really kind of gives you this holistic perspective on how you approach problems and situations in the future. So yeah, that's what I would add for that question.
Awesome. I think you all gave really good answers on that and just kind of showed the broad scope of fields you can go into if this is something that interests you. If, like you said, bedside service isn't kind of your thing, there's so many more things to do with all three of your fields that you could get into. And so I think that's really exciting. And a lot of students will really love to hear that, who might, like you said, after hearing your challenges might go, I don't know if that's for me, but then realize that there's also all of these other paths they can take inside of the medical field. So they're still doing what they maybe love, but it's not necessarily that one-on-one face-to-face interaction that they don't really want to have. So thank you guys so much for your answers on this panel. I think that they're really great, and I think that students will really appreciate hearing this. I think the awesome part about having you three is that you're coming from an academic standpoint too, of being like, these are the literal path you can take to get to where you need to succeed. And that's always, I think, really important to hear personally for students is, okay, what do I need to do to get here? I want to do it, but what do I need to do? Who do I need to talk to? And so I'll reach out to all of you by email after this and would love to hear if you have anything you want us to pass on to students, your contact information, anything like that. And hopefully we can get some of these students motivated to go into some of your programs and reaching out to you all to start talking about what they're going to do after high school. So again, thank you, and have a great rest of your Tuesday, and I'll be reaching out after.
Sounds great.
Thanks,
Thank you.
Charlie.
Thanks,
Nice to meet you all.
everyone. Nice to meet you all. Bye-bye.